Tonight, health officials say 4 people are in quarantine, being monitored in light of the new coronavirus threat. The Health Ministry is calling on the media to report on matters surrounding the new coronavirus responsibly and not to incite panic. And a fire guts the Passios preschool. We have the details of these stories and more coming up.
This is the Hot 7 Nightly News with Lovelace and Amy Joseph.
Good night. It is Tuesday, the 4th of February 2020. Welcome to the Hot 7 TV Nightly News. We're on Flow Channel 117. The broadcast is also being simulcast on Kiss FM Radio. You can watch via our website. It's www.caribbeanhottv.com or on our free Caribbean Hot FM mobile app. I'm Lovely St. Amy Joseph. Thank you for joining us. Chief Medical Officer Dr. Sharon Belmar George has confirmed that 4 people are currently in a 14-day quarantine as they are monitored for new coronavirus. The move forms part of the Health Ministry's protocol for the new virus. Health officials held a press conference on Tuesday to update the nation on preparations in light of the global health risk. Jacques Wooding begins our reporting.
Ministry of Health officials have confirmed 14 Lucian nationals recently returning to the island have been placed in supervised quarantine as a precautionary measure until they are cleared for all viral diseases. To qualify for quarantine, individuals had to have met one or more of the following criteria: having traveled from or near a WHO-recognized disease epicenter within the last 14 days, showing flu-like symptoms upon arrival at a local airport, traveled on a vessel with presumably implicated health declarations, or declared personal concern of infection. Though not limited to the coronavirus, officials say with over 20,000 confirmed cases and a rising death toll, efforts are aimed to mitigate any possible risk factors for infection of St. Lucia's population. As stated in the National Coronavirus Plan, after 14 days of home quarantine, health officials will decide whether there is need for further intervention into each case. Chief Medical Officer Dr. Sharon Belmar George confirms intermediate quarantine areas have been identified at all major health facilities, and the National Viral Quarantine Site of undisclosed location has been confirmed for high-risk cases of viral disease.
For the health facilities, each institution, they've identified an area for isolation if a patient were to come in and become a suspect case. So there would be an initial area within the facility for isolation of a patient. But the quarantine area is one specific area in one specific hospital.
Can you disclose where that is?
Yeah. I don't think we should give those details, but we've identified a space at one of our hospitals. Anyone who has returned is completely asymptomatic. We have twice daily monitoring. We have no symptomatic cases coming from China. That's number one. And according to our protocol, if anybody comes from China and was symptomatic, they would be quarantined at a hospital and not at home.
George says protocol has been established to ensure the monitored return of St. Lucian students who are currently on scholarship in China.
Measures have been put in place for students who may be coming in. In our consultation with the Ministry of Education, we have 16 students in various provinces, and we have made arrangements and allocation to facilitate.
With no confirmed cases of coronavirus in the Caribbean to date, Belmar George urges members of the public to continue to cooperate with health officials as mitigation efforts continue. She underscores that quarantine exercises do not constitute any need for further concern, but are instead an effort of precaution. For Hot 7 News, I am Jacques Wooding.
Meanwhile, the Health Ministry is calling on the media to report on the matters surrounding new coronavirus responsibly. Dr. Belmar George says the matter should not be sensationalized, as it stands to spread unnecessary panic, but more so, it stands to lead to stigmatization of Asian nationals living in St. Lucia.
As the world continues to keep a close eye on the passage of the novel coronavirus, the media has been tasked with the responsibility to report the whole truth and nothing but the truth on the matter. During a press conference on Tuesday, Acting Chief Medical Officer Sharon Belmar George cautioned the media, asking them to be very careful on the contents of their reports on the virus, as careless reporting could lead to a matter of mass hysteria. After false information was reported surrounding a ship that was barred from entry into Port Castries on Saturday, the CMO reminded the media that they should always stick to the facts.
We really rely on you as news persons to work with us to ensure that accurate information is given out to the public and to reduce the level of speculation when we have those incidents. Certain humanitarian requirements are necessary when you have sick people, and we need to keep the focus on that and not go all over the place. We need to work with you to ensure accurate, timely information goes out. And please let it be known that there was no confusion. On Saturday, the necessary protocols were followed, as is what happens every day for a cruise ship coming into the harbor.
Belmar George also called for the stigmatization of Asians to stop, as she explained that it is a pointless practice.
There's a level of stigma and discrimination at this point given to Oriental persons, and we have been given false alerts that persons who look Oriental are being seen as Chinese. What is important is the travel history. You can be of any other nationality and have been in China within 14 days. You would not be allowed in, except for if you say Lucian. Say Lucian, we have special considerations for you. But non-nationals, the important thing is where you were for the last 14 days and not necessarily your nationality. That you could be Chinese and live in the UK for 2 years, and it will not be a problem coming in.
Belmar George said there is a protocol being followed by the sovereign islands, who are working together to keep the virus out. However, each country is deciding what level of risk they are willing to take. In St. Lucia, she said, the priority of the people comes first. Reporting for Hot 7 News, I'm Rochelle Gonzalez.
We have more on the ministry's extensive coronavirus plan coming up a bit later in the newscast. But first, a learning institution for wee ones in Monrepo has gone up in smoke. At approximately 1 a.m. Tuesday, reports were made that smoke and fire was seen emanating from the building. The privately owned and operated Patience Preschool was reportedly engulfed within minutes. Leading firefighter with the St. Lucia Fire Service, Stacey Joseph, explains that firefighters had little to no opportunity to salvage the building.
On Tuesday, 4 February at approximately 1 a.m., a call was received informing of a structural fire in Patience Micoud. Arriving emergency personnel from the Micoud fire station found one structure fully engulfed in flames. The fire, which left the building completely destroyed, was extinguished by the responding crew. No one was reported injured as a result of this incident.
Education Minister and Micoud North MP Dr. Gail Rigobert conducted a site visit of the burned structure and touted the resilience of the Micoud community as plans to attend to the needs of the pupils and facilitators get underway. The cause of the fire is currently under investigation. As the Ministry of Health continues to closely monitor the global new coronavirus epidemic, health officials have announced the commissioning of the 2020 National Coronavirus Plan. Outlining port procedures, the Chief Environmental Health Officer says the best mode of action currently identified is ensuring that presumably infected people are not allowed entry to the island. More in this report.
Though there are no confirmed cases of the 2019 novel coronavirus in St. Lucia to date, given the proclamation of the viral outbreak as a global health emergency, it is believed that the likelihood of importing the disease is high. The Ministry of Health continues to closely monitor the epidemic, which has now risen to over 20,000 confirmed cases in over 24 countries. Announcing the commission of the 2020 National Coronavirus Plan during a press briefing, Chief Environmental Health Officer Parker Ragnanan outlined the approach currently being taken by officials to decrease the vulnerability of St. Lucia's population to the disease.
At this point in time, what we rely on is travel history. Travel history is very, very important. And therefore, we are collaborating with our other partners at the border, including customs and immigration, to be able to share information and be able to determine whether there is somebody that is coming, especially now, out of China. And once we have had that information, the travel history, that passenger is actually taken off the general flow of clearance and is taken into a holding room where they are monitored, their vital signs are done, and they are questioned and information is taken.
Raghunanan says additional medical staff has been deployed to both international ports to provide emergency medical screening as necessary and to assess pilot or captain-issued health declarations before passengers are given clearance to enter the island.
In 2014, the Cabinet of St. Lucia, recognizing the number of ports that we have in St. Lucia, agreed, and there's a cabinet conclusion in terms of that there are 2 ports designated for international health regulation purposes. And these are the Uanora International Airport and the Castries Seaport. That therefore means that at these 2 ports, there must be adequate capacity to respond to any vessel that is coming into St. Lucia, whether it is an aircraft or a seacraft, to be able to respond to an event on board that vessel.
He underscores that the risk of an ongoing outbreak in St. Lucia remains low. However, mitigation efforts will continue, and if any public health measures are seen necessary for the virus, advisories will be released immediately. For Hot 7 News, I am Jacques Wooding.
You're watching the Hot 7 TV Nightly News. Stay with us. There's more coming up after the break.